Good morning everyone. This is a 20-year-old male myope who's got about -3 power with a small cylinder, 0.75 cylinder in the right eye and a 2.5 with a 0.75 in the left eye. And you can see what I'm doing now is taking the applinating cone down. He's asked to look at the green light, and what he does is basically nothing else other than look at the green light, and then you take the cone down. Now this is a convex cone, so it's very cornea friendly. It's got a concave surface, it's got a concave applinating surface, and you can see that I have gone down on his cornea and I'm going to activate suction. So once suction is activated, you can see that it's a well-centered applanation, and now we are going to fire the laser. At this point of time, there should be no movement by the patient at all. This is the 30 seconds where he needs to be absolutely still. This is the posterior lenticular cut that can be seen right now, the side cut which is seen now, and the cap. Now this is the anterior cut. So the femtosecond always cuts from posterior to anterior. This is the anterior cut that's being made now, and that's the last mile incision, which is, you can see, just a 2 mm incision. Suction's off now, so that's all there was. It's about a 23-second or 22-second treatment, and once the laser has been done, now it's time to remove the lenticule. So you have different options. You can do it from between 4 mm to 2 mm, the entry incision. Zoom up please. And now basically the patient needs to look at the light above. And once we've got the cornea into clear view, you can see now that this is the smile incision. Can you look up at this is the entry incision, and I'll just get into clear focus. There it is. It's just a 2 mm incision here. So I've just opened up the 2 mm incision, and now I'm going to go and do the anterior dissection. So that's just making way for myself anteriorly, a route for me to enter once again later. And this is posterior. I've gone posteriorly now. And once I've done that, I've created that route for myself. What I do is I take this, which is a Donenfeld dissector, and it's got the curvature of the cornea, and what I do is just go there and dissect the cap. So what I'm doing now is dissecting the anterior surface, which is the cap, and you can see that that's the dissection of the cap completed. And now I'm going to go posteriorly, and this is the second dissection plane, which is for the lenticule, and the posterior dissection is always a little more difficult than the anterior, but you can see here it's going also very smoothly. And once you've dissected this lenticule, it's time to remove it from the eye. Bent out of angle, yeah. This is the one I prefer normally, so here it is. It's got a better contour, and once it's caught, you need to make this rexus-like movement so that it gets torn from the edges as well, and there it is. So that's the lenticule that has been dissected. 1 drop saline please. And once you have got it out, what you need to do is give me yeah, there it is. So once you open it up, you can see, I'll just get into focus 1 second. I'm not sure if it's clearly visible there, but I'll move it and then you'll be able to see the circular contour all around, and that there is the small lenticule which has come out. Now we just check the interface to see that it's completely clear. You can see I'm just going to focus on the incision, and you can see this is a small little 2 mm incision. There's not even an epithelial defect. So when the patient comes out, he's very comfortable. Check the incision, check the interface, and we don't generally wash the interface because then you might introduce some of the sebaceous secretions into the interface, and you don't want that. There's nothing that's gone in there other than the instruments, so it's a nice clean interface. And now we just put a drop of antibiotic, and that's basically the end of the surgery.